Hey, friends, this is Joe Malone, and joining me this morning to talk about a whole bunch of very important information. We've got Penny McCaslin from CG Public Health and from the Pink and Teal Warriors as well. Love that little logo. We'll talk about that here in just a second. First off, thanks for being here, Penny.
Well, thanks for having me. So excited.
Yeah, well, we're going to talk about Breast Cancer Awareness Month, about the Care for Yourself program, a really great and important program that is offered here in North Iowa with CG Public Health. But first, let's talk food, because I don't know about you, but it's been a hot minute since I've had breakfast. So lunchtime coming up, supper time tonight. Tell me what the Pink and Teal Warriors are and what you're doing with Applebee's.
So the Pink and Teal Warriors are a group of cancer survivors, family members, and advocates. So we are working to earn funds that we can help enhance the, survival. So helping families in the journey and post journey in any way we can. So Applebee's is helping us out this time, and they always have great fundraisers. So today, if you have a meal at Applebee's and want to let them know that you'd like the proceeds to go to this campaign, we would really appreciate that. Go to help breast cancer survivors and awareness and the whole picture over at Applebee's, here in Mason City. So
excellent. Find out if they still got that Oreo shake. Yes.
So many good things. Yes. So anything off of the menu, I believe, anything off of the menu, 25% goes to the Pink and Teal Warriors. So, but the caveat is that you do need to let your wait staff know that, like I said, you'd like it to go to this campaign.
Yeah, just say we're here for the fundraiser, Pink and Teal Warriors. Easy, simple, just like that. Awesome. Very cool that Applebee's is helping out with that. Well, it is Breast Cancer Awareness Month, and that is one of the things that is covered with the Care for Yourself program with CG Public Health. And Penny, can you kind of talk us through what this program does, how someone gets involved with it, all of that?
Okay, so yes, this program is, like you said, a breast and cervical cancer early detection program. It is available in all counties in Iowa, and we get the honor of serving Cervical County and surrounding area with this. So women can apply, by giving me a quick call. It's really simple to enroll and takes about 15 minutes. We take some basic information, basically just to see if you're in the eligibility zone, which is, it's a very graceful income is probably the biggest eligibility requirement. And so, but that's pretty graceful, like I said. And of course, in the ages 21 and up, we do go more than 64 years old if they're not on Medicare and Medicaid. But I've had clients, I think I have one now who is 71. So anyway, it's a great program. It's very simple and easy, I think, for the participant. We get you into the doctor of your choice and to have that annual physical. And then age appropriateness as far as the mammogram. So we schedule that for you. Help ensure that you get in on any follow-up that needs to take place. Sometimes they need to take like additional views or want to do an ultrasound too, just to make sure that what they're seeing or what they're not. And so we can cover all of that.
Now, is this the sort of thing, and forgive me for asking maybe not the right questions or whatnot, but is this the sort of thing that we need to see a physician, see a doctor, and then go to public health and the Care for Yourself program? Or do we start at the Care for Yourself program and then you help us get to the physician? Like, how does that work?
The physicians, local physicians, well, all across the state, so many of them are very good about, like, if you are already at, seeing them, and they know there's a need, they're very good about referring you to the program. And or if you just know that, gosh, it's been a while since I've had my annual physical, and I really need to, because we do need to keep tabs on that. Early detection is very important. And so if you feel like, if a person feels like it's time to have their physical, or, maybe this is first time for your mammogram, give me a call right off, just directly. or on our website at cghealth.com. There's an action button where you can just send me your information. How and when is it best to connect with you? Is that by email or phone call during these hours? And I try to respond to those as soon as possible. I just had a couple this morning. And so then we work to, like I said, take some of that basic information, determine your eligibility, and then get you going on those appointments and try to get you through that just as quick and simple as possible. So,
and you want to be busy. Make Penny busy. Yeah. Call, get these appointments scheduled, find out if you qualify, and get these screenings done, because early detection saves lives. It's proven. It's a fact.
Absolutely, it is. You know, Joe, the Iowa Cancer Report estimates that in Iowa alone that we will have over 2,900 breast cancer diagnoses this year. And so, again, that early detection allows for better survivability, better quality of life through that survival. It has a huge impact. And so that's what this program is all about. Please don't put it off if you don't think that, gosh, I don't have, I don't have the funds to pay for that doctor appointment or even the copay. Some people are just absolutely underinsured, and we can help pay the copays. Another thing that this program does, and I'm so glad, is that women with a higher risk score, one of the recommendations, the standards is to, as well as having that annual mammogram, is to also offset by 6 months is to have an annual MRI, just to keep tabs on your status. Now, some insurances haven't caught up to that, and some insurances aren't covering that, but this program does. And we just had a case last year where a woman was having her annual MRI, just a screening MRI, and they did find a cancer. And thankfully, it was like stage 1, and she had a very good, outcome. So that's what we hope for everybody, is to get in here. Don't put it off because you don't think you can pay for it, because we might be able to help, and we certainly try in every way we can. So
now, can you remind me, is there a certain age, like, once you hit 30 or 35 or 40, that you're supposed to be getting these screenings done? Does it change depending on the screening? When should people have this in their head, like, oh, I need to schedule this soon?
Okay, so if we're talking about mammograms, probably 40. And that might, some standards look at doing every 2 years, but depending on your situation, and that's something very individual to a person. You should, talk with your provider about that. But definitely having it every year is allowable too. So we usually go with the every year because we feel like that, as long as if that's how often a woman wants to have them, then we go with that every year. And like I said, just to keep tabs on your status, just to know.
Just to know. Yeah. Once again, if you want to find out more information, get enrolled in the Care for Yourself program, call Penny, 421-9315, or click that link at cghealth.com. That's cghealth.com. And then, Penny, before we go, want to reiterate that today, get your food at Applebee's in Mason City, because you can eat and then you can give back to the Pink and Teal Warriors and your mission of helping people out through the fight of cancer.
Yes. We hope to see you all out there. We'll have a table. We'll be handing out pink ribbons. And that's just another great way to remind people, to honor survivors and people who are going through that journey and their family members, but then also to remind people throughout the month to get those screenings.
Get those screenings. Well, Penny, thank you so much. Always a pleasure to talk to you. Always good to see you as well. And I hope that there is a line out the door at Applebee's, and then a line out the door at Public Health of people waiting for the Care for Yourself program to come and see you as well. So.
I do too. Thanks so much. We're ready. Give us a call.
All right. Thanks, Penny. That's Penny from CG Public Health with us.